So we have dealt regarding the topic HIV AIDS. Now moving on to post-exposure prophylaxis, which is referred as PEP. Okay. Post-exposure prophylaxis can also be referred as occupational exposure. Okay, occupational exposure refers to exposure to potentially blood-borne infection that occurs at the healthcare settings, and this post-exposure prophylaxis refers to comprehensive medical management in order to reduce the risk of infection in the healthcare workers. Okay, and this occupational exposure is nothing but it refers to the exposure to harmful substances or harmful materials while the person is working in the industry or working in the occupational settings. Now, in a healthcare worker, HCW means in a healthcare worker, usually they are at risk of contracting certain blood-borne infections like HIV, hepatitis, it could be hepatitis B or hepatitis C, and even other pathogens. Okay. So what is the definition of post-exposure prophylaxis? Post-exposure prophylaxis refers to preventive medical treatment that should be started immediately after exposure to certain disease-causing viruses like HIV, hepatitis B, hepatitis C in order to prevent the infection by these viruses and development of the disease. Okay, so once you have got exposed to any of these viruses, you will have to take the prophylaxis that is referred as post-exposure prophylaxis. Now, particularly when a person has got a needle stick injury, they will have to take this post-exposure prophylaxis. Okay, so a needle stick injury is referred as a percutaneous piercing wound that is set by a needle point but possibly also by sharp instruments or by objects. Okay. So commonly it is encountered with the people who are handling the needles, especially those who are in the medical settings, okay, or in the laboratories or in the casualty. Okay, so that is referred as a needle stick injury, especially when they are getting injured or trauma, when they receive the trauma or injury because of the needle prick. Okay. So next is what infections can happen because of this sharp objects, as I have already told, HIV or AIDS, hepatitis B and hepatitis C. Okay. So these are the certain blood-borne infections that can happen because of the sharp objects. Now, what are the sharp objects? We have sharp objects are those devices that are intentionally sharp and that may cause puncture to the skin or they may cut the skin. Okay. Now, sharp objects can be like your needles, scalpel, or your IV devices, pipette, glass containers, or scalpel, or even your suture needles. All this are referred as sharp objects. Okay, and certain activities which will increase the risk of getting injuries by the sharp objects include recapping the needles. Okay, you have the habit of giving injections, and after that, what you will do, you will recap the needles after the use. So, recapping the needles is one of the major causes for needle stick injuries. And one more way of getting in touch with this blood-borne infections include transferring body or any other fluids in the container. So when you are transferring this body fluids in the container, chances are there that it will splash or sometimes your skin may come in contact with this liquid. Okay. So these are the ways in which you can contract the blood-borne infections. Okay. So immediately when you come in contact with the sharp objects and all, immediately you have to take the measures that is referred as the post-exposure prophylaxis. Okay. So sharp management is having some certain principles, that is needles should not be recapped. Okay. Never go to recap the needles or never go to bend the needles or break it by your hand and all. So chances are there that when you are trying to manipulate them by the hand, you can get the injury. Okay. Next is types of occupational exposure protocol. So which are the type of occupational exposures? So already we have seen it could be needle stick injuries or because of cut with sharp instruments, sometimes splash to the eyes, nose or mouth. Sometimes chances are there that you are having an IV injection, you have to push the IV injection and it is a positive patient. Okay, sometimes what will happen, the IV injection that you are giving may splash back or something liquids that you are pouring in the wound may splash into your eyes, nose or mouth. That chances are also there. One more way of occupational exposure is direct exposure to the non-intact skin. Maybe you have got any cuts or wounds. So the blood or the body fluids have come in contact with your skin. Okay. Now all this occupational exposure, the type of exposure depends on depth of the injury, how much big the injury is. It also depends on the size and the type of the needle. Okay. Next is it depends on the amount of blood that has entered inside the person's body. Okay. How much amount of patient's blood has entered inside the person's body, that also it will depend on. Okay, so based on all these factors, it depends whether infection is going to come or not. Next is post-exposure prophylaxis for healthcare workers. So first of all, what you have to do? Okay, post-exposure prophylaxis means you have to take antiretroviral therapy or antiretroviral treatment has to be taken once you have come in contact with the splash or once you have come in contact with the needle stick injury. Okay, so that you will not get the HIV infection. So always remember the prophylaxis should start immediately after the exposure. So immediately you have got a needle stick injury, immediately you have to inform the in charge who is there and you may have to go for the treatment. Okay. It is told that if the therapy is delayed for more than 72 hours and after that you are taking the treatment, it will not be effective. So please remember that treatment should be started immediately and should not cannot be taken after 72 hours because it will not have any benefit. Next is the course of the therapy should be continued for around 4 weeks. Okay. So the prescribed medications may need to be taken for around 4 weeks or depending on how much the physician has told to take. Okay. And when you are taking this post-exposure prophylaxis treatment, the nurse, the person who has got exposed or person who is taking the treatment should be prepared for the side effects because we have already discussed the side effects of this HIV drugs, isn't it? So once you are taking the treatment, you may have to face the side effects also. Okay. Now what you have to do immediately when you get a needle stick injury? Remain calm, okay, and dispose the sharp object appropriately. You can wash the wound, that is the puncture area, with soap and water. Okay, don't try to squeeze the wound or don't try to put the pricked finger in your mouth by squeezing the blood inside your mouth and all. Don't go to do such things. Just wash the area with soap and water, that is the region where you have got the needle stick injury, and immediately go to the in charge and to the physician and tell that you have got a needle stick injury. Okay. Next, what you have to do is identify the patient, whose it was, whose syringe it is. You will be knowing obviously because you have given injection to the patient and you have come back. So identify the patient and try to find out if the patient was having HIV, hepatitis B or hepatitis C. Okay. So once the status is known, you will know what to do. If the patient is positive, you will have to go for post-exposure prophylaxis. If the status is unknown, in that case, start the prophylaxis within 2 hours. Okay. So within 2 hours, you have to start the post-exposure prophylaxis and not after 72 hours. And continue the medications for 4 weeks, and until that, it is better to avoid sex or to have safe sex practices. Then it is recommended that after taking the medications. Okay, you have to go for testing or screening at 1 month, 3 months, 6 months, and perhaps at 1 year. Okay, but the CDC recommends that at least at 6 weeks, 3 months, and 6 months you may have to test. Okay, for HIV or for hepatitis B. Okay, next is document the exposure in the records of the employer. Okay, so the person who has received the needle stick injury, most of the time they may need counseling. Okay, because the exposed person needs appropriate information about the post exposure treatment. They may need psychological support, and at the same time you have to also document the exposure. Okay, maybe they will need some special leaves at least for 2 weeks. Next is, if at all there is a splash, okay, splash of the blood is there of an HIV patient, then what you will do is immediately go for washing. Okay, wash the eyes, eye irrigation with water or with saline can be done. And if using contact lens, leave them in place while irrigating and remove once you have cleaned the eyes. Okay, once you have cleaned the eyes, you can immediately remove the contact lens and clean those also. If blood or body fluid has entered inside the mouth, spit the fluid immediately, don't swallow it. Then take adequate amount of water and rinse the mouth thoroughly with water and saline. Okay, no need to use soap or disinfectant. Next is, what type of post-exposure prophylaxis have to be taken. Commonly, they are advising a basic treatment and an expanded regimen. Under basic treatment, 2 drugs are given. Under expanded treatment, 3 drugs are given. So this is the regimen. So initially, for 2 drug regimen, you can see here, they will be giving zidovudin or stavudin, either zidovudin or stavudin. Along with that, compulsory you have to take lamivudin. Okay, just remember the names of the drugs. You need not remember how much mg and all. Okay. So remember, under true drug combination, what they will give is zidovudin or stavudin. Along with that, lamivudin compulsory they will give. Okay, these drugs will not be given in true 2 drug regimen. Next is expanded drug regimen, that is 3 drug regimen. They will be giving zidovudin or stavudin, either of these two. Along with that, compulsory they will give lamivudin. Okay, and then what they will do is they have to give protease inhibitors. Okay, protease inhibitors commonly they will give is lopinavir. Okay, lopinavir or ritonavir can be given, or if this is not available, they can go for nelfinavir. Okay, they can go for nelfinavir. Just remember the drugs which I have told, need not remember the exact dosage and other things which is given in this slide. Next is side effects. So already we are knowing the nurse who has got the needle stick injury, who is taking the post-exposure prophylaxis may experience side effects of the drugs like nausea, vomiting, diarrhea, headache, body pain, severe muscle pain, or even fatigue is also very common. Okay. So this is particularly about the post-exposure prophylaxis.